Medicare Advantage is crony capitalism. That's what it is. The government pays private companies with taxpayer dollars to fund the healthcare program Medicare Advantage. The difference between original Medicare and Medicare Advantage is simple, though. There's checks and balances. These are private companies that are trying to make money. The original Medicare is taxpayer dollars, and it is technically, it would be a socialist program. It is a classic redistribution of wealth in the form of senior citizens deserving health care and not being able to, they need to be able to enjoy retirement. And I think it's a great program. I think it's one of the best that the government's ever created. The problem with it is this: original Medicare is regulated by federal employees. Federal employees have zero, zilch, nada desire to have real checks and balances. They clock in every day. I've mentioned this before. People say I'm an idiot. Crazy. The government employees have no desire to be making sure that things are medically necessary. That is why Medicare Advantage is the future of Medicare. Because even though it's crony capitalism and the money comes from taxpayer dollars, it's still regulated in a more efficient manner. So if a Medicare Advantage plan on average spends $800 a month per member, original Medicare on average spends $1,200 a month per member, because they're not regulating it properly. So that is the difference. And that is why Medicare Advantage, again, is the future of Medicare. And there's nothing that you or anyone can do about it. And quite frankly, you shouldn't want to, because Medicare has spoiled you over the past, however many years it's been in effect. And it's spoiled doctors and nursing staffs and billing departments. And that's going to come to an end, because not only is Medicare going to implement prior authorization, but Medicare Advantage is going to going to hold 75 to 80% of the market by 2030. And then what are you going to do? So there's that.